Thank you, Wade. There are so many people in this room who either individually or as a leader or as a person who cared and got involved or shared their experience that we want to thank. Many of you are also part of organizations who also have been working on this issue for a long, long time. And I did want to make sure that we recognize some of those, our partner organizations in this effort. Many of the organizations in the North Dakota Healthcare Reform Coalition included AARP North Dakota, AFSCME, which is American Federation of State, County, and Municipal Employees, the AFL-CIO's Labor Council, Missouri Valley Central Labor Council, the Northern Plains United Labor Council in Grand Forks, the Northern Valley Labor Council in Fargo, I think that's which, Change That Works, North Dakota, Children's Defense Fund, Consumers Union, the North Dakota Education Association, the North Dakota Public Employees Association, ndpeople.org, the North Dakota Nurses Association, the North Dakota Women's Network, the Northern Plains Conference of the United Church of Christ, Planned Parenthood of Minnesota, North Dakota, South Dakota, the Presentation Peace and Justice Center in Fargo, the United Tribes Technical College Wellness Program. And we also work with the North Dakota Farmers Union, hospitals, doctors, business people, and many others. And at this time, it's when people like that all come together, no matter what, there may be some differences of opinion. When you come together, work together, a goal is achieved. So thank you very much. An organization, the Children's Defense Fund, Paul Ronningen, to come up and say a few words. Paul is the coordinator of the Children's Defense Fund North Dakota. Paul and the members of his group care about children and are working to make sure that children have access and their parents can afford the health care that they need. It is and will continue to be a pleasure working with Paul Ronningen. Please join me in welcoming Paul.
Years and decades past, and people I've yet to meet. I really feel blessed to be here tonight as we celebrate this victory and this monumental blessing for the people I represent. When we were going around last fall, we talked about 8 million kids in the United States who didn't have coverage. In North Dakota, we have 13,000 kids who don't have coverage, and in fact represented towns like Jamestown, the population base of not having coverage. But tonight we get here and we want to say thank you. And I know the struggles that our congressional delegation has gone through this last year. And I especially want to thank Earl Pomeroy, yes on this particular bill. As we move forward, we're going to have many struggles. Tonight's a celebration, but as we move through the summer, we're going to have more celebrations. Again, I hate to read to people, but I have one letter in front of me that I want to share with you. It's from Kathleen Sebelius, who is writing to America's Health Insurance Plan's Executive Director, telling her there's no ambiguity in the law that just passed. And it goes, children with pre-existing conditions may not be denied access to their parents' health insurance plans. Insurance companies will no longer be allowed to insure a child, but exclude treatments for that child's pre-existing conditions. And as you know, so many families have gone bankrupt in North Dakota and nationally because of events beyond their control. And I just want to again say thank you to each one of you, to our congressional delegation, and to the leadership that Don and others have provided to us over the last several years as we've fought the good fight. So again, thank you.